For those of you coming back from our previous sessions, welcome back. For those of you just joining us, welcome to Goode Intelligence Identify 2021. Our second afternoon live session is on the critical role of identity verification for health and vaccine passports. A hotly debated topic that's been pushed to the front of the agenda due to the COVID-19 health crisis. We should be discussing what they are, why they're needed, and some of the technical, social and privacy problems with rolling them out. We shall also explore what happens after we get back to some degree of normality. I'd like to welcome our experts and panelists to join me, and then I'd like to ask them each individually to introduce themselves. So if we can go unmute and share your video, please, that'd be much appreciated. Thank you. Dan, as your top left, could you introduce yourself, please?
Hi, everyone. I'm Dan Johnson. I'm from Mastercard. I am responsible for business development of our digital identity service in the global travel vertical.
Thanks, Dan. Kirsty Innes.
Hi, I'm Kirsty Innes. I'm the Director for Digital Government at the Tony Blair Institute for Global Change, where our team is looking at how we can radically remake the state to fit the digital era and use tech to transform public services.
Thanks, Kirsty. And Dr. Manreet Nijjar.
Hi, everyone. I'm Mani. I'm a consultant in infectious diseases. I'm Associate Clinical Lead for the response in East London at Barts Health. I've also been in digital identity for the last 6 years around doctors having credentials so they can move around.
Thanks, Manny. And Andy Smith.
Hello, everybody. My name is Andy Smith. I'm part of SITA's COVID recovery team, looking at our engagement with government, industry and stakeholders on our path to COVID recovery, particularly health information.
Thanks, Andy. And Sandra.
Hi, I am Sandra Trenevska, a Senior Product Manager on the innovation team at Interac. I oversee development of our digital identity product solution, and I'm focused on making sure we're building a safe and secure customer-centric product. I'm excited to be on this panel and have a discussion on identification challenges and opportunities within the health space. So thank you for inviting me to be a participant.
Pleasure, Sandra. Thank you. And Steve Grant.
Thanks, Alan. Thanks for the invitation to be here today. Steve Grant. I'm with WorldReach Software, recently acquired by Entrust. Based in Ottawa, I'm responsible for business development. We're active in travel and transportation issues around identity.
Thank you to all of you for that introduction. I would like to kick off with a question to all the panelists on what do you believe is the purpose of health and vaccine passports, their benefits and disadvantages. Starting off with Kirsty Innes from the Institute of Global Change. Thank you. Thanks.
Well, to try and be concise about it, I think the purpose of health passes is to act as a tool to help us manage the spread of COVID-19, and their benefit is to help us limit the risk of transmission of the disease as we reopen after a year and a bit of lockdown. The benefits, will unpack in terms of reducing infections and fatalities, and also in terms of, I think, helping us open up faster than we otherwise might have confidence to do when we lift the restrictions. And if we're talking about disadvantages, I think there are clear challenges in terms of technicalities of putting together a solution that works for businesses and for individuals, and that's also internationally interoperable, but those are all surmountable. I think the broader challenge is probably the political and policy one of putting in place a framework that sets out clear parameters for how the health pass is going to be used, who uses it, who monitors, who runs it, who administers it, how it's paid for, and again how it works at the international angle. So I think those are not necessarily disadvantages, but they are clear challenges.
Thank you. It's a great start. And then Steve, your views on this, please.
Sure. I think we do have to look through the lens of what is the use case. And I'm much more comfortable talking about use cases involving borders and travel. Domestic use cases, I think it's a totally different situation. I'm not an ethicist. Maybe we should have one on the panel to discuss some of those complications. But For travel and transportation, governments, one of the main purposes of governments is to protect their citizens. And I think we're seeing that manifested in the calls for verification of credentials, health credentials at the border. And look forward to getting into some of the details around that as we discuss it further. Thanks, Steve. And over to you, Dan.
I think that health passes will help to reintroduce certainty back into our lives. If we just take the travel use case, then it used to be that you needed your tickets, money and passport and maybe a toothbrush, and then you're all set to go. Now it's a little bit more complicated than that, in that there are constantly changing rules about what tests you need to have, when you need to have had them, who you need to have got them by, whether you're vaccinated once or twice, what you're vaccinated with, and so on. And those rules continually change. And that's causing confusion and concern and uncertainty for travelers. And it's not just about global travel. The same thing it exists when going back to work. So again, you don't want to infect your colleagues, or maybe you do, and you want to be able to attend events safely with lots of other people, and you want to know that the other people are not going to infect you. So having that kind of certainty of knowing whether you're compliant with the requirements for a destination or an event or going into the office, I think is really important, and that I think is the thing that we've lost as a result of the introduction of lockdowns and other mechanisms to help to manage the control the spread of this rather awful disease.
Thanks, Dan. And your views, Sandra?
I think Kirsty summarized it very well. I'm not sure how much I can add in terms of looking at it from a COVID perspective. We did a survey last year where more than half of the participants, and we surveyed 1,000 participants across the country, said it's more important now than pre-COVID to access health online. And the survey also showed that the participants are demanding that they have hygiene concerns around physical IDs, and they're demanding that we're transacting in ways that reduce physical contact more often now than prior to the pandemic. So as much as the health vaccination passports will help crossing borders more easily and conveniently, I think it's important to look at having access to your health records easily, conveniently, and securely, because it's important as a citizen, and it will allow you to transact and I guess have control of what's being shared, and always have easy access to any records that you need for whatever reason.
Thank you. That's excellent. And for you, Manny?
Well, yeah, this is very complicated. First of all, I think with my infectious diseases, a global public health hat on, is a vaccine passport the right thing? I think that's all about context. I don't think you can say it is or it isn't. It's in the context of why you're using it. And I think that is one problem we have. I think policymakers have a really important part to play to understanding the disease. For example, what country can do it, and then the risk of introducing variants. Like for me personally, on a global health thing, is I think we should lift patents and get everyone vaccinated, so you don't need vaccine passports, right? But to Sandra's point, and this is the conversation that really excites me, this is about personal health information and how it's held. It's not about a vaccine passport. And what are the ethics around that and how we hold it and who polices that, and it should be the individual. And I think touch to a point of, as a medical professional, I have a lot of trust, and that's based around medical ethics. And actually they translate to data ethics if you use certain technical implementations. And it's how much do you trust someone to hold a central database about you, about stuff about you that they can do and use and stuff, right? And I think those are the complexities. First, do you need a vaccine passport? I think the only thing we have at the moment is yellow fever, different disease, endemic in a small area, international law. If you can get that in COVID, that's not going to happen very quickly. That took years, right? And then each different country is going to make a different rule and a different law. We can use this jab or not that jab, and it's all going to be very politically driven, especially if you look at the Green Health Pass saying the Covishield, which is the AZ vaccine that is being manufactured in India, is not going to be accepted, but the one that's manufactured in the UK will be, right? So it is really broad and complex, and that's, I think, you are in a place where you might create a two-tiered world on vaccine passports. As general, the developed countries will steam ahead, developing countries will be left behind. It's just the reality, right? And how we do it, and what responsibility do we have regarding that? Because actually because we could get into a cycle, create a variant from a developing country coming to us, and then we're back at step one, even though we thought vaccine passports were the right thing to do. If they're not infrastructure, every gate, and look at the SITA guys, and like, that's the thing, right? You're going to need that infrastructure at every single, there's going to need to be a way of doing it, right? Which sticks to those ethics. And that is the challenge, I think.
Thank you. Definitely. I understand that. So nicely segged into Andy at SITA.
Yeah, I'm going to issue the first challenge. I don't think we should talk about a vaccine passport. It isn't a vaccine passport. It's the sharing of health status information as part of the travel journey. People don't get vaccinated generally to travel. They get vaccinated for public health reasons, for their own health reasons, and for a myriad of others that Manny will know far better than I do. I think the benefits, as has already been mentioned, and that's the problem with going last, is we've got to find a way of reopening travel. We've got to find a way of living with a horrible disease, but we've lived with horrible diseases before. We need to understand the implication. We will live with other horrible diseases as well going forward. I think one of the things we're learning, not only as an industry, but as a society, is how do we put in place that infrastructure that Manny was talking about to operate with the next pandemic, with the COVID-23, 24, whatever it'll be. And I think we need to get those processes and policies in place to allow people to be comfortable to share it, to give all stakeholders the confidence that we can operate the industry by minimizing risk. There is no such thing as zero risk, and we need to get stakeholders and particularly policymakers and regulators to accept that there is no such thing as zero risk. And unfortunately, today's environment, governments are operating on that zero risk mentality. And we need, as an industry, need to come together to show that there is an acceptable level of risk, that we are doing everything we can to manage and mitigate it, but we need to find ways of ethically, securely, safely sharing health status information at the right levels. Now, I would also challenge that we've been doing health status information for decades. It's normally forms part of that questionnaire that you fill on a digital landing card of what have you been exposed to. HIV questions are often asked, but even health status information of have you been to a farm, which is more around mad cow disease, Creutzfeldt-Jakob. So I think we're used to it. We're just approaching it in a different way now, and we're digitizing that information and using the advances of technology that we're going to talk about on this call, I'm sure, to give more assurance and confidence to the traveller, to the stakeholders and to the regulators that we can share health status information effectively.
It's very well put, Andy. And I think it kind of, it's a lot of it is about trust and basically how do you gain the public's trust for adoption of such solutions? If we talk about health status certificates, Manny, can I ask you that question first?
I think you can find that issue now. I think if you look at the NHS at the moment, it's obviously publicly available about NHS Digital trying to get GP data off individuals, right? We've been here before with the NHS, right? Right. So if I look at how do I gain trust, well, my patients, I have a code of ethics that I'm accountable to, right? Hippocrates wrote it hundreds of years ago, and it's given us trust, right? It's autonomy, yeah. It's about confidentiality, which is privacy. These are all stuff around data, right? And authenticity of data, which is actually what identity is, right? Components of that. Is that true about you? So autonomy, am I in control? Is it going to benefit me? Is it not going to do any harm, right? Really nicely put in there, right? I think one of the switches, we've had this rapid digital health transformation, and it's cutting across industry because every traveler is a patient, right? And we've always looked at silos. As an infectious diseases physician, I don't look at silos because infection can go anywhere, heart, lungs. My colleagues, however, are very siloed. They just look at the heart of the cardiologist. the neurologist looks at the brain. And so for me, I look at system, it's a system-wide approach, right? And how does that all cut across and work? So I think being transparent and actually having an ethical framework to make solutions, and that's a tick off, would be something, as opposed to here's the technology and we're going to push this. I think the reverse needs to happen, personally. And if you want to play, you have to meet these things and you have to show, and that has to be audited, in my personal opinion. I think that's how you gain trust, right? And then you can talk about the technical solutions. And I think it's right. I think what Andy said is, I've said from day one, even here, it's all about mitigating and reducing risk. We're never going to get 100%. But 80% is better than 60%, which is better than 40%, right? And it's how we increment that, and be open and honest, learn from your mistakes. Don't try and cover it up, all right? Recognize them, do the impact analysis. Like how we do when we develop a drug, right? We do the post-surveillance studies, right? We need to do this for digital solutions. If this is having a negative impact on society, we'll pull it. But the problem is, if it gets implemented too much and there's too much of a commercial interest, you're gone, you're not going to catch that. And it's getting that balance and checks in, and how do you do that?
Yeah, but there are an incredible amount of stakeholders in this, isn't there? So it's difficult getting that kind of overall kind of strategy to roll something out of this. In terms of the kind of the matter of trust, anybody want to chip in and add to Manny's comments, please? And Kirsty?
Yeah, I think Manny's totally right to mention transparency. I think that policymakers and the UK government especially needs to be super clear about why we're introducing a solution like this, if we are going to, and what it's for, what it's not for. And part of that is about the timing and the application for this. So I think, if you were designing a society from a blank sheet of paper, would you want people to have to disclose anything about their health status when they went into, any venue, a care home, a shop, an office? No, you wouldn't. But we are living in a situation of a health emergency. And to deal with that, we have undergone some incredibly restrictive conditions, lockdown and social distancing and all kinds of hardships. In the context of that, I think sharing health information about yourself is a really small price to pay. But I think the government needs to be super transparent that the requirement to share that information is part of the management of this specific pandemic. I would agree with Andy that having the infrastructure in place will be really useful for decades to come, because this isn't the last global pandemic that we'll see. But there's a distinction between, we are introducing health passes, and it means that from now on, anytime you go anywhere, you'll need to show your health pass. And this is a tool that we are developing to help us manage the exit from this set of really restrictive measures and specific to COVID-19, and something that we will switch off when we have the disease under control. Especially in the domestic context, which I agree with Steve, does feel significantly different for people to imagine doing this going into shops, bars, businesses at home than it does showing health status when they are traveling abroad.
Yeah, because there's an imperative, isn't it? I want to travel either on business or for kind of leisure, and it's a requirement. So yeah, and I think this is why we've seen, especially in the UK, that kind of withdrawal of the mandate, saying that you had to kind of use it at barbers or a pub, etc. So yeah, so I agree with that. So for you, Dan, and just a reminder for people, I know someone's raised their hand just now. If you've got a question for the panel, then please use the Q&A function at the bottom of the screen, and then we can bring that question to their attention. So for Dan, why is this relevant now? And is it short term, i.e. only relevant until everyone is vaccinated against COVID?
No, I don't think that it's short term at all. I think that it's relevant now because we've experienced this rather horrific but catalytic moment. As Manny said, he's been in the identity space for some time. In fact, all of us on this call have been involved in identity or digital identity, and we kind of recognize that the world would be a great place if there were a privacy respecting, inclusive solution that would allow anybody to be able to share specific pieces of information about themselves with other people and with organizations. So when I go to the pub, because I'm a very youthful looking person, I like to have a drink, and I get asked for ID all the time, as you can imagine. And I have to show my driver's license, which has a whole load of information on me. And that's not right. What I'd like to be able to do is to say, yes, I'm over the age of 18. I'd equally like to be able to say, yes, I've been vaccinated, or yes, I've undergone a particular test, or that I'm O negative, or whatever my blood type is, or whatever I want to share. I should be able to do that in a privacy respecting way without oversharing lots of information. I think what's happened here is that while many of us have been working in this space and in this industry for some time, and we've been pushing towards this grand vision where that ecosystem exists, it hasn't, because it is exactly that. It's an ecosystem. It requires lots of partners to have a demand and a capability at the same time. What's happened recently with this global pandemic is there are lots of people looking for answers, looking for ways to solve this problem, and also having a need to solve the problem. So it's really pushed the agenda much harder than it has done prior. None of this is a new conversation. It's a pre-existing conversation. It's just that fewer people were interested in it as little as 18 months ago. Now there are more and more people interested in it, and there is a lot to be done, as Kirsty says, in education and providing the right knowledge and information to decision makers and policy makers to demonstrate why this is important, and that it's not short term. It's something that I think once implemented, and assuming that it is done in the right way, it is going to stay with us. I'm still going to want to be able to share health data. I'm still going to want to be able to share whether I'm of legal age for drinking and so on, as we go forward and as we come out of this this current pandemic and current situation. So no, I don't think this is short term. I think there's a short focus that is helping us move forward with the digital identity agenda, but I don't think that the health passport is the kind of end state. I think that's just a catalytic moment for moving forward with a broader context of data sharing.
Okay,
Andy, you wanted to interject there?
Yeah, just really to support what Dan was saying. Certainly, I don't believe it's short term either. Every group I've been on believes that health data of some form will be here to stay. Whether it's digitising the yellow fever information, we've already had governments asking about Zika, dengue, West Nile, whatever it might be. They're going to want this information. But I think one of the things we do need to remember is that we've been dealing with identity for decades. We all travel with a passport, with an identity. The challenge we've got now is that, first of all, we have to bind an identity to a health status. And again, when I went and got vaccinated, I didn't take my passport with me. So we now need to link my NHS record with my passport information. If, in fact, we could do that, and you could just present your travel document, and in the background we were doing checks on vaccine information, I actually don't think the public would mind. I think, providing, as Kirsty said, that we're open and transparent, that is happening. When you cross a border now, dozens of checks are carried out on you on various systems and information and international databases, dozens of databases within a government, all to come back with a, you may cross this border. We could just add health status to that check. But the trouble is we've got these two worlds that need to bridge together, health and travel and immigration. These all need to come together. And that's the challenge I think we're facing, is articulating it and helping these two worlds collide softly.
Yeah. Steve, so do you want to come in on the question on what is the relationship between a passport and a traveler's health status credential?
Sure. I'll pick up on what Andy said. I think we might have a solution for that binding problem, Andy. We have a little bit of experience doing that. So what is the relationship? Well, they're both needed to cross a border. And while there may be an expectation of privacy when you're living your private life in the UK or any other country and going about your business and going to the pub, as soon as you cross an international border, that expectation of privacy disappears. So there are things you need to disclose. And to Andy's point, there's lots of checks being done on anybody. So and he's right. There's nobody checking your passport when you're getting your first jab or your second jab. And in some countries, the identity verification might be very weak. So you do need to have a verification and a binding of that travel document with the health status. About the only way it can be done is comparing some of the key data fields. Is the birth date the same? Is the first name, second name the same? Because there is no, in most countries, there isn't going to be an identity indicator captured. It might be a health number, some kind of here in Ontario where I live, there is a health number which is managed by the provincial government, which is a subnational government. That's another complication in this, that receiving states where you're traveling to, they're going to expect a health credential to be issued or signed by the national level government. And in many places like Australia, like Germany, like the United States, the actual point of delivery of that health service is subnational. I actually think some of the things we're talking about here today will make for a very good end state where we can share this information without disclosing, without oversharing. But unfortunately, we're still in the middle of it right now. And governments are asking to see the raw data. They want to see the name of the vaccination that was used, when it was delivered, who delivered it. They want to see the raw data. And if you look at the technical specifications for some of the standards out there, the ICAO VDS, the WHO, the EU DCC, the digital COVID certificate, they all require the raw data to be exposed in the barcode in the clear. So there's no privacy there because they have no alternative. Their governments are demanding that they protect the borders, and that's the solution that they've chosen. ICAO also is looking out as part of the UN philosophy of no country left behind, making sure that whatever schemes are put in place, that less developed, less well-equipped countries are able to consume this data without onerous requirements for equipment and technology. And by putting the health credential data in the clear, that's one way of being able to communicate that data to other countries.
Yeah, I can see that. Yeah, so there is a lot of initiatives going on at the moment, and some of them are joined up, and some of them are kind of individual. The Good Health Pass, ICAO, and obviously individual initiatives done by the airlines themselves. So are we in a situation where there's a lot of talk but not a lot of action, and we're going to get in a situation where perhaps we're all vaccinated and things have got much better, and there's no need for this because we haven't deployed anything?
I'll jump in before Andy does, because I know he is right in the middle of this. I'm kind of on the edges. There's a lot going on. There is an awful lot of action, and that's part of the problem. There are going to be, 24 different flavors at least of health credentials in circulation. So if you are a border management agency or a public health agency, how are you going to deal with all of these different certificates that are being presented at your border? The answer, I believe, it's to not deal with them at the border, is to deal with them pre-travel, have these certificates communicated electronically, and have some technology that is able to interpret them and recognize them for what they are, and have the risk assessments done before the person even gets on the plane. We do that today for terrorists and people that are on the UN naughty books for different reasons. We can do this with health credentials. Yeah.
Andy?
100% agree. 100% agree with that. And I think as well, we've got two different scenarios though. Whilst we've still got testing, that makes it more challenging. This testing is very short term. At one point, the Netherlands were demanding 4 hours test validity before departure. Now, you can't have pre-travel authorization really when you're dealing with those short windows. As we move more away from testing to the vaccination information and vaccination status, I think we will see more pre-travel authorization. And also, I think that fits with the narrative that people like IATA are explaining, that it should be a relationship between traveller and destination government, not necessarily involving the airlines as custodian of health information. So I would be more comfortable sharing the information with a government that I want, of a nation I want to go and see, than perhaps with my airline. And that the government can then make that travel authorization permission rather like an ESTA, an ETA. And I do see in the future an expansion of electronic travel authorization, including health status.
Are any regions around the world kind of looking at also what type of vaccine you've had and when you've had it, in terms of, is it going down to that granular level? And is that important, Manny?
So I think I mentioned the Green Health, the EU isn't taking the Covishield vaccine. I think on Andy's point, from a global health and infectious diseases point of view, I think we still don't know what's happening, right? So you're making the assumptions vaccine will work. There might be escape. So testing is so important. Test, right? It will get quicker, it will get better, right? Whether that health information is a vaccine information or a test result, that doesn't, for me, doesn't really matter. Whether it's pre-authorization 24-hour, what are you accepting and what's the thing? For me, testing is more important generally. But like any test, even like we do in hospital, how is the test taken? Who takes it? How is it transported? That people don't understand all the variabilities, because we very binary, false, positive, like, right? But if you understand that, and then you put, look, there's that window of error that we're going to put to everything, and we take that and we mitigate it, and you have everything in place, right? And the other thing is your incentive. What are your incentive models, right? If we go back to the first ethic, autonomy, an individual's choice, right? I am not an anti-vaxxer. I want people to be vaccinated. I want the world to get vaccinated. But for some reason, if someone doesn't get vaccinated, but you're saying the only way they can travel is to get vaccinated, right? What are you, and that comes to the ethics, right? And to Kirsty's point, the context is now about a public health safety, so you can put that in now, right? But as we move forward, and trust and data is this bit of this surveillance capitalism, the governments are learning that Facebook had all this power. So why wouldn't they use this model? Why would I? And that, I think, and I think the general public are starting to learn about the value of their own data. I think that's the big shift. And I think how do you navigate both of those things? And that's why the models of privacy and non-correlation, but it's just, there needs to be the context, because actually it should be up to the individual. Because I might say, you know what, I don't care about my privacy, it's already out there, too late. But I should at least understand the options. But I think that's a very difficult thing to navigate. Yeah.
So obviously with post 9/11 had a fundamental impact on security for air travel, and it added a hell of a lot of friction. So are we seeing that type of effect as a result of COVID to digital identity and health status? So Andy, what do you see the future for identity in travel over the next 5, 10, 20 years?
Well, just in terms of the friction that's been introduced, you're absolutely right, Alan. The vast majority of digital health passes, certificates, even when there's some kind of technical interoperability that was mentioned at the very start, is predicated on reading a QR code.
Yeah.
And that means going to an airport and having it checked in person, predominantly. We cannot operate at scale. So we've spent decades as an industry facilitating the experience, streamlining the process, making safe and seamless traveller journey capable, biometric enablement through the airport. And we've interjected this manual process that quite often regulators think that we all go to an airport to check in. They've thought that for years with some of the programs around. We don't. Some airlines operate at 98% off-airport check-in. They no longer have the staff available to process in-airport check-in. And the health status information and requirements have added this huge amount of friction. Changi Airport have had to maintain 100% staffing levels for less than 15% of traffic volumes. That's not sustainable. At the border, as Steve mentioned, we've gone from 90-second processing time when you're seeing a border officer to 15 to 20 minutes in order for them to check bits of paper, which led to 6-7 hour queues in Heathrow, flights being diverted. It's introduced an incredible amount of friction. What's going to change? absolutely, as Steve said, we need to move to digital checking of information. We need to move off airport, so that as we do the check-in at the moment, when you, on your mobile phone, on your computer at home, you're checking in, the health status checks are also carried out at that time. Now, I agree with what Manny said, though. The testing is going to be a part of the travel for, I don't know, I'd look to Manny to tell us, but I'm reckoning at least 18 months, maybe 2 years, that we're going to need testing for. So we need, even 5, I don't think 5 years. I hope not anyway. I think there will be a mitigation, and there will be cohorts of people that will be tested on arrival rather than necessarily on departure. And hopefully, as Manny will know far better than me, those tests will be quicker, cheaper, simpler, faster. So we can do more on arrival testing, just to sort of do checks and balance. But we've got to move to this space of being able to do health status checks before they arrive at the airport.
So in your opinion, this is going to stick, this kind of, the need for this infrastructure is going to stick around going forward?
I fear that rather like 9/11, and in fact every security incident has ratcheted up the requirements. And I've yet to see a government ratchet down the information it requests. So I certainly believe that some form of health status, maybe it will be particular routes, but health status information will probably be a feature of required traveller data for years to come. And I also think people will take advantage of the level of fraud and corruption around the yellow fever certificate is immense. You can buy these in any airport for about $50 and just write your own name in. But this hasn't got my name on it anywhere. So I think we can take something from this crisis that will now digitize some of this information that was open to fraud. That said, we operate in a world where there's 60 million fraudulent passports in the circulation. So there is going to still be fraud. There is going to be manipulation of the system, nefarious and accidental. And we need to find a way, as Manny said as well, of mitigating the risk, operating at a level that is acceptable, but also that will vary. So as the next pandemic, they'll ratchet up the measures again. As they rescind, they'll ratchet down. Will they ever disappear? I have my doubts.
Yeah, very good point. Anyone else want to add into that conversation?
Oh, I was wondering, I'd love to hear the views of the other panelists on this. Where people raise concerns about health passes, how much is it about privacy, in that they really don't want to share information about their vaccination status, and how much is it about convenience or kind of friction? And just envisaging that idea that Andy just described of checking in ahead of a flight, to me, putting my passport details in, putting my flight details in, putting in my vaccination details, that feels very sort of straightforward, and it feels a world removed from turning up at an airport and having to produce the documentation there, or having to even using an app there, which I think would be fairly straightforward. I wondered if that's the same in the domestic context, whether part of the sort of reluctance to contemplate using health pass in domestic situations is about kind of not wanting to introduce that friction into everyday life, rather than about the sensitivity of the information. Because, I mean, yeah, Manny will know much more about this but it feels to me as though whether or not I've had a vaccine, and when it was, and even what type it was, it doesn't feel to me like the most sensitive kind of information. Like, if someone asked me that on the door of a bar, I wouldn't mind saying. There's something about the process that is that people sort of feel reluctant to embrace, I think.
I've got a very quick point on that. I don't think it's the process of that. I think there's two things here. I think if you look at politically, and it's all politics generally, if you look at what happened at Cambridge Analytica and Facebook and political things, I don't care, but if you know where I've been and the system tracks every time I've checked in somewhere, that information is going to tell you something about me. You are then going to feed me some stuff which is going to influence me. I think that's where I come from, right? Because that metadata is so much more powerful as you getting a picture of me. All right, that is more of my concern, right? And then I think the other thing is about, if we look at it at travel, what is it? You guys will know better, Andy and Steve, and the rest of you, but I don't know, is it 15, 20 or 25% of the population that travels regularly, right? And then there's this whole other people who don't really travel that much, right? And so are we catering just for the elite in society, or the ones who are driving business and commercial? And how do we, and if we're bringing it domestically, right? These are all the things that you have to think about. For me, I have to treat whoever comes through the door, right? Because it's open. Right, and how we look at it, and it is important because we do need to get travel going again. We do need to get the economy going again, because that everything is interrelated, and people don't think that, right? It is like lockdown has had huge stuff on mental health, and that's going to impact outcomes and stuff like that. And those are for me, I think that's the privacy and correlation bit, not the actual process of sharing that information. And the other thing was during the first, I think, lockdown, when you were giving your numbers, or people were selling it on, right? I don't want advertising. I don't want my local pubs sending off my phone number and whatever. Like, how do you put those checks and balances in? That's my initial thing.
I agree. I think it's a lot about the how, rather than the what. So I think, you know, as Manny mentioned earlier about people are becoming more wise to value exchange, and will share data if they see that they are getting good value from it. So if I have to share my health data in order to travel, and I really want to travel, then I'm likely to share that health data. And if I don't want to share that health data, then maybe I don't want to travel quite that much. And people are starting to become wise to that kind of value exchange. It is really about then how that is implemented and the level of trust that people have with that data. So, for example, I did like to go to the pub when I was allowed to, and but I didn't like writing my name and my number down in a book, because anybody could look in that book and make decisions about me, and I didn't like that. So I was much more comfortable with the idea of scanning the QR code and then having that logged in my device, because I felt that was a much more privacy-centric solution. So I was okay with that. If the only option to me at that time was writing my name and my number in a book, then I wouldn't have gone, because I didn't feel that was an appropriate value exchange.
Yeah,
Manny asked the question about who travels, and pre-COVID there were about 1 million international movements per year, and if you take away me and Andy and our colleagues, that doesn't really account for a large portion, maybe significant. But travel and tourism, it's not just the frequent travelers. It's people are traveling for work, for migration purposes, to receive healthcare. There's all kinds of different reasons. I really see, though, that there's the context, as we've discussed earlier, is so important here. International, like I said, there's an expectation that you're not going to have privacy, but domestically, if you need to show this to get into the pub and to get into the bookstore, and all of those purchases are tracked, and I'm sure Dan and Sandra have lots of interesting use cases about the data that they manage. That's one element. What about requiring a proof of health status for employment purposes? That's a whole other situation. I'm a traveler, and I'm in the travel space. I don't really have a well-formed opinion about some of those other social uses of the passes.
Yeah, definitely. That kind of brings us on to kind of other kind of uses of kind of a digital identity credential for health reasons outside of COVID and outside of travel. So if I can come to you, Sandra, and ask you, what do you believe the benefits are for healthcare providers and patients if we were to have a health digital credential?
I mean, there's a lot of benefits for both sides. From a healthcare provider, I would say it will definitely improve patient satisfaction. Healthcare providers can speed registrations, check-ins, as well as securely provide telehealth and other remotely delivered options for care. When I go to one family doctor and I'm traveling and I'm supposed to share my data, I have to reshare or be there and explain my whole health history to this new healthcare provider, because I don't have quick access to my data. Another is that, and it was mentioned a few times, it reduces fraud risk. I know we're opening up a lot of opportunities going digital for fraud, but we're also addressing a lot of risk for fraud. I think by the way we're going to do that is ensuring that only verified patients can order and pick up drugs that have been prescribed to them, and only eligible patients are being serviced. I think that also digital health credentials will capture efficiencies by enabling the secure use and sharing of electronic health records in patient care, in government billing, and in archival record keeping. For patients and families, it obviously improves privacy and security, ensuring that a patient can access in-person and online healthcare services without fearing the loss of their personally identifiable information or health data. Offers obviously a greater convenience through the provisioning of a digital credential. Patients can again reduce the paperwork that we need to like fill out on registration, or when moving to a new province, to a new state, to a new country. It will, I think the most important one is that it enhances control of information by allowing patients and their families to better manage which providers have access to their health records. So that's at a very high level what I think the benefits are for both healthcare providers and patients and families.
Yeah, Andy, go ahead.
I was going to ask Manny actually on this one, but you've just touched on something, Sandra, there. Sharing health records is something that has been happening for years. When people move house and change states and move location. And I understand there's lots of rules and regulations around and formats for that. Hasn't COVID just brought it to the public attention about ways of sharing data and more use cases around the sharing of the data than there have been before?
Yeah, so look, for me, the work I do separately on the identity bit of clinicians and holding our data so we don't have to do pre-employment checks, and as Steve said, occupational health, we need to make sure I'm not HIV and my Hep B immunized. We already do that, right? That's the use case we want to work, which is very similar, right? But the issue is they're all siloed in different electronic health record systems everywhere, right? Now, if we move to a world where it's a two-pronged attack, is where the patient, yes, if they can hold it, it becomes patient care is number one, right, for what we do. So if I can have as much information about an individual and I know it's authentic and trusted, I can make decisions quicker. I don't need to do repeated investigations. I can save money and I can start treatment quicker. So that's priority. But actually, if you can verify who you are, as Sandra said, you could authenticate into legacy systems just to read. And then from an ethics point of view, if we get the infrastructure right, we could run audits to say, why did you access this record? And I can prove, well, this patient is in my hospital, I've accessed you based on, and you know who I am because I've got a credential that gives me. So I think, that is the way the future would work if we get it right. But no, yeah, Andy, it's been such a problem. The best case I've seen of this was in Bangladesh. It was about 4 hours north of Dhaka in a really poor village. They got one health record and that was their access to free care. They couldn't read, they couldn't write, but they could go to 4 or 5 different clinics and everyone knew. And that is basically what we're trying to do in a digital format. And this was only 3-4 years ago. And I was like, why don't we do that, right? You start off with an e-red book in the UK, but then we decide we don't want to look after it. We look after our bank statements, we look after the deeds. There is this culture of why you don't want to look after your own health information. That's just in a paper format that you forget any other. And that I think the medical profession needs to actually as well, because information is power, right? Control, right? And those things need to kind of rebalance and change. I'm very open, but I'm sure other people might not be, because if I have, the more information I have, I can use that data, run algorithms on, make commercial interests, right? I'm sure the electronic health providers, the big American ones which have the market globally, aren't really open to opening this up, right? It goes against their business model. So it's that as well, right? Where do you?
From a patient's perspective, a recent kind of experience has been not particularly good at all, because I have a blood test every year, and I've got to use one system to book my blood test, which is provided by a private provider. I've also got a patient care kind of web access with my GP, which allows me to do some things, but not on everything. I've still got to ring up and book an appointment and to check my the blood test that I may have had. And then I've got a new thing called an NHS app, which I can do some things, but not all things. So from a user's perspective, it's really clunky, and I'm sure you have a similar experience of working as a practitioner as well, Manny.
Yeah, and that's the focus. It's all about customer-centric, user-centric, and balancing it out, because it's always been organizational-centric. And actually, the systems we use aren't friendly. They make an impact, and it's yeah, for you, Alan, that's frustrating, right? And it's your health, and we live in a world of hyper-convenience, right? I can order food within 30 seconds. I just need to press a button to get Domino's, right? I can get into a banking app and know my money like that, right? Well, your health is the most important thing. If you don't have that, you can't do any of the others, right? Like, why is it so difficult? And for me, I really want to put health tech at the front, and COVID is amazing for that. So working with you guys, speaking to you guys, it's amazing, because it has to be this cross-pollination. It has to, and it's an interest, right? We're always 25 years behind finance or travel or whatever, right? But hopefully this will push us up and go, actually, we can start doing this and understand the importance of getting it right, but not losing the ethics. I think that's, for me, is the really important thing, because that's where we have our trust, and that's the really important thing.
So kind of Sandra and Stephen, obviously, based in Canada. What's your experience there? You've done very well. There's DIAC, and there's some really good kind of initiatives around, identity and credentials, and within Canada and between states. And so, what is your experience in Canada? Is it less frustrating than mine?
Not for health information. No. Okay. Most GPs are just in the process of digitizing health records. In my situation, I know that for example, my optometrist has been automated for several years, but my GP is not. So you still go to her office and you see the stacks and racks of paper files, and that's how she operates. So there's lots of talk about digital health records, certainly within the province of Ontario. There was a failed project a few years ago, but I would say in general, we're a little bit behind the UK.
Okay, all right, thank you for that. So kind of we're coming up to the end of the hour. Sandra's back. She kind of, Sandra, I was going to ask you your experience. Obviously, you kind of worked in the for Interac and been doing work on digital identity. Is it a vision that from you as a provider and as kind of entranced in the identity world in Canada? Is it a vision to improve the situation?
Andy, can you repeat the question? I literally just joined in.
No worries. It was following up from Steve. Steve said the experience was awful and it was worse than the UK, which I can't believe. And so the question is that what's been done, from a Canadian perspective? I know there's a lot of initiatives going on to improve the kind of the situation with accessing health services and for having identity that kind of enables this.
I mean, we're working on it from a technology perspective. Typically, when things go digital, there is from a citizen's perspective, yes, things are not great. From a professional experience, from Interac side, we are working on trying to close that gap, including the health use case. So typically when things go digital, there is a requirement for a trusted network for these credentials to be exchanged. So perfect example of that is what happened to the payment space. And I'm sure Dawn will agree with this, but we went from cash to cards to Apple Pay and Google Pay type of credentials. And the network was always needed to exist once you move from physical to digital. So this trusted network is necessary in order for to bring the supply and the demand together. That is the merchants, the credential issuers, whether that's government or otherwise, and the citizens together. So from my perspective, this digital identity ecosystem needs to have the same type of participants, the issuers, the relying parties, and the user needs to be in the center of it. There needs to be a tight binding between these three parties in order for this to work in a trusted and privacy enhancing way.
Fantastic. Right. So kind of closing remarks from everyone. So where are we, and what do you believe the status of kind of health credentials, vaccine passports are going to be like in the near to medium term? Starting with you, Kirsty, because I started with you at the beginning.
Yeah, sure. It just struck me from the past 5 minutes of our conversation, the gap between the perception of what government could possibly do with your data and what data they might gather about you if you use the health status app, from your location to purchases to all kinds of things, and what data they do actually hold and are able to produce when you need to find your health records and transfer them from one authority to another. There's the huge mismatch between perception and real capability. Yeah. And I think that's got to be the key challenge for governments, really making clear and frank and honest their intentions and their sort of processes about how they store and use citizens' data, and how they're going to use that to support solutions such as health passes. That's a huge challenge. But that being said, I'm convinced that both health passes and a much broader and much more user-friendly health data ecosystem are going to be permanent features of our future. They have to be. So I think this is not going away anytime soon.
Just mind the gap, yeah?
Yeah.
Dan, if I turn to you.
Oops. First one to have missed the mute button, sorry. There's always one, isn't there? I think the main thing really is to ensure that any solutions that we create are good and fit for purpose. And there is an initiative, so a shameless plug for some of the work that Mastercard and other organisations on this call have contributed into, the Good Health Pass Collaborative, which is concerned with making sure that the solutions are inclusive and are fit for purpose and are user-centric and respect privacy. And it's really making sure that that knowledge and that information is available to decision makers and policy makers, so that they can understand the art of the possible without worrying about maybe legacy approaches to solution design. So the answer doesn't have to be a massive database with everybody's health records in it. That there are other ways of solving this problem.
Okay, and for you, Manny, closing remarks.
Yeah, I think you did answer. I think implementation is going to be important. Even the technology, you can have the same technology, but it can be implemented 10 different ways, right? So that's one thing. I think the other point is trust again, because actually you can talk about this, and Kirsty can talk about, it's ultimately what's the political game. In the truth of the matter is, like, if you look at the NHS and the deals with Palantir, and these are things people don't want to talk about publicly, but that's where it comes to, because people investigate it. And right, how can we have open, transparent conversations for the interest, not just for our generation, but actually this is like, we come to a tipping point, right? Future generations, our children's children, and how data is used and how we move as a society, whether it's health data or any data, financial data, movement data. I think that for me is the broader context. I think it's here to stay. I think as long as it's done the right way and it's all context specific and transparent for what is it used, why is it used, and nothing else. That has to be very clear. I think that's the issue we have at the moment, because it's used for other things, which at the moment it's.
Thank you, Manny. Andy?
Yeah, I agree with everything said so far. I think, well, I'd circle back to something Kirsty said at the very start. There are a lot of challenges. I think a lot of groups have addressed the technical challenges that are overcome, and I have confidence that we'll continue to evolve the technology behind it. I think we need to find a way of giving regulators, politicians, an understanding of the operational impact of this new world and this new status. It isn't a technical problem, it's an operational problem. It's how do we live with sharing this information? How do we operate a travel ecosystem? Going to the pub, if Dan doesn't want to show how many times he goes there in a day, more sensitively, how do we operate in this environment where we are operating like we used to, but with this new set of information that needs to be shared?
Yeah, definitely. Closing remarks, Steve, and then we'll go to Sandra.
Yeah, the travel and transportation use case is the one I'm most comfortable with, rather than the general one, and that's what I'll talk about. So 9/11 was a big catalyst for the introduction of electronic passports. And within about 5 years, the major source countries of travelers had implemented electronic passports. But we're now 20 years on from 9/11, and not all countries have e-passports yet. It takes a long time. So legacy technology is a big issue at the borders, and we have to deal with it. So some of the things we've talked about, I think, make a great end vision or an end state that we can aspire to. But it's going to be a messy road to get there, and we need to work with these legacy environments. We need to make allowances for the less capable countries, so they can open up their economies as well.
Okay, Sandra.
I think an important part of getting this right is having clearly articulated set of principles to guide the effort, regardless of if it's a company or an organization that falls in the public or private sector, or a combination of the two. And I believe there is 5. Trust is probably the most important one that I would put on top, which we already mentioned. The second one we already mentioned is control over what data is being used, being shared, for the user to have, or the citizen to have, control over that data. The other one that I would like to mention is the standards. So we have to build today's solutions on a universally agreed standards. We need ubiquity. We need a ubiquitous system that would be a system that is more convenient and more secure system. And lastly, security. I think security is very important, and how we do it, whether that's like via abstraction of that data and protecting that data, however technology solution providers do that, it needs to be secure.
Okay, thank you. I'm afraid that's all we have time for this session. I'd like to big thank you. Very much appreciate your time today, to all our speakers and panelists today. And I'm sure that we'll hear a lot more about this subject, and I, for one, am looking forward to being able to travel safely and to meet you all in person. Any unanswered questions, we will follow up individually with you. A big thank you to all of you for making this a really great Q&A session. I hope you can make it all for our final session of the day, starting at 5:30 UK time, Fraud Biometrics and the Identity Lifecycle with Sanjay Gupta from Mytech. I look forward in seeing you at 5:30. Thank you.